Hey everyone, and welcome back to the channel. I'm Dr. Nerita, and as a urologist, I get asked a lot of questions about men's health. Some are common, some are a bit unusual, but one question that pops up time and time again is this: is it okay to ejaculate every day? What really happens to my body? It's a great question, and there's a lot of misinformation out there. You might have heard everything from it'll make you go blind to is the secret to a long life. So today, we're going to dive deep, separate fact from fiction, and give you a clear science-backed answer. We'll talk about your prostate, your hormones, your mental health, and even your fertility. So, if you've ever wondered about this, stick around. Let's get into it. First, let's start with the basics. What exactly is ejaculation? It's a complex process involving your nervous system, muscles, and reproductive organs, all working together to release semen. Your body is constantly producing these components. Think of it like a factory that's always running. The question is, what happens when you increase the shipping frequency? Does the factory run out of supplies? The short answer is no. Your body is incredibly efficient at replenishing this supply. Now, let's address one of the biggest areas of interest, the prostate. The prostate is a small gland that's a key part of the male reproductive system. There's been a lot of research into the link between ejaculation frequency and prostate health, specifically regarding prostate cancer risk. Several large-scale studies have suggested a fascinating correlation. One very famous study published in the journal European Urology followed tens of thousands of men over nearly 2 decades. It found that men who reported ejaculating more frequently, specifically 21 or more times a month, had a significantly lower risk of developing prostate cancer compared to those who ejaculated less often, say 4 to 7 times a month. The theory is that regular ejaculation might help flush out potentially harmful substances or carcinogens from the prostate. It could also reduce inflammation within the gland. Now, it's crucial to understand that this is a correlation, not a direct cause and effect guarantee. Other factors like diet, exercise, and genetics play a massive role. But that's certainly a compelling piece of evidence suggesting that frequent ejaculation might have a protective benefit for your prostate. Alright, what about your hormones, particularly testosterone? This is a common myth I want to debunk right away. Many people believe that ejaculating frequently will drain your testosterone levels, making you feel tired or less masculine. This simply isn't true. While there is a very slight temporary spike in testosterone levels, if you abstain for a few days, your overall baseline testosterone is not significantly affected by daily ejaculation. Your body regulates hormone production through a complex feedback system, and is not so fragile that daily activity would throw it off balance. Your testosterone levels are influenced far more by things like your age, overall health, sleep quality, diet, and exercise habits. So, if you're worried that daily ejaculation is tanking your T levels, you can put that concern to rest. Your body's hormonal system is more robust than that. Let's shift gears and talk about mental and emotional health. This is where the effects can be very individual. For many people, orgasm and ejaculation trigger the release of a cocktail of feel-good brain chemicals, like dopamine, endorphins, and oxytocin. Dopamine is linked to pleasure and reward. Endorphins are your body's natural pain relievers and mood elevators. And oxytocin is often called the bonding hormone, promoting feelings of closeness and relaxation. This chemical release can be a great stress reliever. It can help you relax, improve your mood, and even help you sleep better. In this sense, daily ejaculation can be a positive part of a healthy routine. However, it's all about context. If the act becomes compulsive, or if it starts to interfere with your daily life, your work, or your relationships, then it might be a sign of a deeper issue that needs to be addressed. It's about balance and ensuring the habit serves your well-being rather than controls it. What about fertility? This is a key question for men who are trying to conceive with a partner. Will ejaculating every day harm your chances? The answer is a bit nuanced. When you ejaculate daily, the volume of semen in each ejaculation might decrease slightly. The general advice for couples trying to conceive is often to have intercourse every 1 to 2 days around the time of ovulation. So, daily ejaculation in this context is perfectly fine and often recommended. So, are there any downsides at all? From a purely physical medical standpoint, for a healthy individual, there are very few risks associated with ejaculating every day. The most common issue would be simple skin irritation or chafing from the physical act itself, which is easily managed. Some people might feel a bit tired afterward due to the release of hormones like prolactin, which promotes sleepiness, but this is usually temporary. The more significant downsides are often psychological or social, as we touched on earlier. If it becomes a compulsion, causes you distress, or negatively impacts your relationships and responsibilities, that's when it crosses from a healthy habit to a potential problem. It's all about your personal context and how it makes you feel. If it feels good, reduces stress, and doesn't interfere with your life, then your body is perfectly capable of handling it. Let's do a quick recap of what we've learned. Second, research suggests that frequent ejaculation may actually be good for your prostate health, potentially lowering the risk of prostate cancer. Third, the myth that it drains your testosterone is just that, a myth. Your hormone levels are stable. Fourth, it can be a fantastic stress reliever and mood booster, thanks to the release of endorphins and dopamine. Fifth, for couples trying to conceive, daily ejaculation is generally fine, and can even be beneficial for sperm quality. And finally, the main potential downsides aren't medical, but rather psychological, relating to compulsion or interference with daily life. So, the bottom line from a urologist's perspective? If you want to ejaculate every day and it feels good to you, go for it. Listen to your body. There is no medical reason to avoid it, and there are several potential health benefits. It's a natural, healthy bodily function. The myths and stigmas that have surrounded this topic for centuries are largely unfounded. The most important thing is to have a healthy relationship with your own sexuality, one that is based on personal well-being, not on arbitrary rules or fears. Your health is a combination of your physical, mental, and emotional states, and for many, this is a positive contributor to all three. Thank you so much for joining me today for this important discussion. I hope this clears up some confusion and empowers you with the facts. If you found this video helpful, please give it a thumbs up. And don't forget to subscribe to the channel and hit that notification bell so you don't miss our future videos on men's health. Do you have other questions you'd like me to cover? Drop them in the comments below. Stay healthy, stay informed, and I'll see you in the next video.